My name is Richard Lance Snyder, and I'm a physician here at the Jacksonville Orthopaedic Institute. Rotator cuff injuries are very common, and as we age, our tissues tend to degenerate somewhat, and they tend to lessen in terms of their blood supply. And so rotator cuff injuries are much more common as we age, especially in overhead athletes, tennis players, people that lift weights overhead. And so oftentimes there's an injury to the rotator cuff area. Rotator cuff is made up of 4 small muscles, and typically the supraspinatus, or the top rotator cuff muscle, is the one that gets torn. Now, not all rotator cuff tears need to be operated on. If they're partial thickness tears, often they can be rehabilitated with physical therapy. Rotator cuff surgery, while it's very effective, can be quite painful. And so we want to try to do most things to be conservative and to avoid surgery, but oftentimes it is needed. A lot of people that are overhead thrower athletes, tennis players, we see it quite commonly in pickleball players, volleyball players, and so forth here at the beach. But also, it's more common in the overhead labor, or people that smoke or have other factors. People with diabetes often have rotator cuff tears. And those people are more prone to have worse rotator cuff tears and the need for surgery. So after the age of 55, it's very common to have a rotator cuff tear, and that gets worse as we age, and certainly longevity. Right now we're living longer and longer with the average life expectancy, and so it's very common among the 70 to 80-year-old patient to have a rotator cuff tear. So certainly in Florida we have a lot of healthy 70-year-olds, and oftentimes they can undergo the rigors of physical therapy and surgery. But sometimes when people get up into their 80s, it's not a great option. And obviously, we're going to try to treat people conservatively starting off anyway. So that's always the goal, is to try to avoid surgery if at all possible.